Okay, so this video is going to go through the taping technique for plantar heel pain, plantar fasciitis, plantar fasciopathy. It's got a whole range of names. The plan is to unload or offload the plantar fascia to reduce pain and tension on where the plantar fascia inserts. The way we do that is we try and turn in the heel or invert the heel, and we try and plantar flex the first ray. So I'm going to show you a taping technique that does that. One thing that you need to just make sure your patient is aware of, that the tape is quite tight. Generally they won't care if it gets rid of the heel pain, so just making sure that the tape does go on quite firm. The other thing is that I will always put some sort of protective tincture down over the foot. You can do that with a sports spray. I'm using TB Co or Fry's Balsam. Makes the foot nice and sticky, and I'm going to tell the patient to keep this on for about 2 to 3 days, so it acts as a little bit of a barrier between the skin and the tape. I generally tape without gloves on, it just makes life easier. We're going to use 2 lengths of tape, so we can either use a 1-inch tape or 1.5-inch tape and a 2-inch tape. Selection of tape is pretty important as well. You want to use a rigid sports tape. Don't use a rock tape or kinesio taping or active tape that has a bit of give in it. You want something that's quite firm. So we're going to pre-measure the tape on the foot, and we're going to start on the outside border of the foot, starting over the 5th toe, bringing it back round and plantar flexing or pushing down on that first rail, that big toe. Pushing all of that in and trying to make sure we don't have any creases in our tape. Then we're going to run an anchor. Again, from the first toe, we want to apply that force that is going to pull the toe down, coming across to the 5th toe. Then we're going to apply some strips on the base of the foot. It doesn't matter whether we go from the inside part of the foot to the outside part of the foot with this, or vice versa. The goal here is just to get some longitudinal support underneath the foot. And with this size foot, I'm going to do 3. Skinnier or smaller foot, we can get away with 2. And then we move to 2-inch tape. Okay, so I pre-measure again, all the time, remembering what I'm trying to do. Plantar flex the first, invert the heel. So I put it on the big toe, I apply a plantar flex force or pull down a little bit, and then I bring that across. And then I follow that back. This time I come the other way because I'm wanting to invert the rear foot. So I start on the lateral side, apply a force pulling up through the arch of the foot, down through the midfoot, and the final piece of tape over the rear foot. Again, starting on the lateral side because I'm wanting to invert the heel and anchoring off on the medial side. Finally, I'll do one final strip, which doesn't really have much of a function. It's just holding all of those strips that I just placed on in place and anchoring them off. final piece on the dorsal aspect of the foot. Don't want to do this too tight because when the patient sits down or stands down, the foot will become wider. So put it on too tight, they'll be uncomfortable. So I just put that fairly loose. There we go.